personalized acupressure for the treatment of pain and other co-occurring symptoms in cancer survivors. So the overview of my talk, I'm basically going to be talking about three different related things: pain and co-occurring symptoms in cancer survivors, self-administered acupressure for the treatment of those symptoms, and then looking mechanistically at brain outcomes which may be related to acupressure's effects. So cancer survivors often have a cluster of symptoms present in them. These can be pain, fatigue, poor sleep, depression, anxiety, as well as cognitive problems. You may remember that this morning when I was talking about fibromyalgia patients, that they also have the same constellation of symptoms. In many cases, this can be triggered by stressors, for example, military deployment, sexual or physical abuse as children, or infections, as well as pain. It's now becoming increasingly recognized that these comorbid symptoms occur together in specific individuals. And while they occur in specific individuals, they're not always in pain patients. So for example, some of these conditions can also be found in cancer survivors. So persistent cancer-related pain and fatigue are very common. So for breast cancer survivors, 40 to 50% of them express some amount of pain. 30% of survivors report significant fatigue. 20 to 30% report depressive symptoms, and even 40 to 50% report symptoms of sleep disturbance. Of all of these, patients consider fatigue as the most burdensome. One might be wondering how best to treat these individuals. Would it be better to treat all of the symptoms all at once, or would it be better to treat one symptom at a time? For example, would it be better to treat pain first and then worry about other symptoms later, or would it be better to treat fatigue first, for example? Overall, the conventional approach has largely been to treat one symptom at a time rather than the whole symptom cluster. And also the research that's been done to try to understand what's driving this symptom cluster has largely been focused on individual symptoms. What about acupuncture? There's some data which suggests that acupuncture has been effective at reducing cancer-related symptom clusters. There's been a study by Mao et al. Suggesting that acupuncture can improve aromatase inhibitor breast cancer pain and fatigue and sleep and depression. There's been a couple of studies that have shown that acupuncture can reduce post-chemotherapy fatigue. However, the average reduction is quite small. It's about 30%, and that size is even smaller when you consider placebo-controlled or sham-controlled studies. What about self-acupressure? We think that self-acupressure is really a very interesting treatment because it's low cost, it's essentially free once the patient learns how to do it to themselves. It requires minimal instruction. It only takes about 15 minutes for someone to learn how to perform self-acupressure. Another thing is that the patient controls the dosing and the timing, so they can treat themselves whenever they want. They can control how intense that treatment is. And in doing so, that empowers the patient, giving them power to control their own symptoms rather than having to rely on the physician, which then reduces practitioner burden because you don't need as many physicians to treat these patients because they're treating themselves. And it's also helpful to think of acupressure for vulnerable groups such as elderly individuals or children because self-acupressure is less intense. I'm going to talk a little bit today about a clinical trial that we did at the University of Michigan that specifically addressed the action of self-acupressure in breast cancer survivors. We had 288 completers randomized to either have relaxing acupressure or stimulating acupressure or usual care. So this is a comparison of two active acupressure formulas. The relaxing acupressure formula was designed to reduce stress and anxiety and to promote the relaxation response. And in doing so, we thought that that would reduce fatigue because they were relaxed and potentially getting more sleep. The stimulating acupressure group, on the other hand, was designed to increase activity during the day, such that daytime activity might be enhanced, and then they would have less fatigue. So they were given, so we taught them how to do self-acupressure over the course of 6 weeks of treatment, and they were followed by 4 weeks of a washout. And they did acupressure daily for 30 minutes. What did it look like? These are the results. On the left, you can see a graph of change in fatigue on the y-axis. Fatigue is on the y-axis here, and time is on the x-axis. So the first 6 weeks of treatment, you can see that both the relaxing and the stimulating acupressure groups had a significant drop in their fatigue score, whereas the usual care group showed no change whatsoever. And what I'm plotting in the gray bar here on the bottom is normal levels of fatigue. So that would be, everybody in the audience is probably experiencing some fatigue from being in this meeting. So levels of around 4 are the threshold for normal fatigue. So you can see that the relaxing and stimulating groups reached normal levels of fatigue. We also had effects on sleep. Again, relaxing actually had somewhat better of a response at reducing poor sleep compared to stimulating and usual care. Both of those were significant and highly different from the usual control group. So what about the other symptoms? What about pain? What about depression and anxiety? Did those change? Yes, they did. We found a significant decrease in pain for both the relaxing and stimulating groups, as you can see here. Pain goes down for both acupressure treatment groups, but the usual care group shows basically no change at all in pain. Depression, we had a significant effect, and we also had a significant effect with anxiety. So the self-acupressure treatment is hitting the cluster. It's treating all of the symptoms all at once. Every symptom is getting better with this treatment, which we thought was really exciting. But one thing that was puzzling to us was that if you look at specific individuals, there didn't seem to be a correlation between whether someone improved in fatigue or sleep, or if someone improved in pain or fatigue, or if someone improved in pain or sleep. So even though pain was improved, sleep was improved, fatigue was improved, it wasn't in the same individuals. So for some reason, the self-acupressure was affecting these individuals differently, but in all of them, there was improvements in the symptoms. So it was really quite puzzling. So that leads us to wonder, how might self-acupressure be working? And how it works, we really need to understand the symptom cluster. And in the symptom cluster field, we don't really know what's driving these multiple symptoms. So it looks like, to boil it down, in the symptom cluster field, it looks like there's an effect of the cancer treatments, either the cancer tumor or the intense treatment, that causes a change or an increase in cytokines and chemokines, which then act on the brain and then cause things such as pain and fatigue, etc. So it's thought that either the cancer tumor itself or the treatment that we give the patient is causing an increase in these cytokines, which then has an effect on the brain. So we wanted to see if that was happening. And so what we did was a clinical trial, a mechanistic study in breast cancer survivors, where we did some brain imaging techniques similar to what Dr. Kong was talking about in his talk. And we used, but the thing that we were focusing on specifically was proton magnetic resonance spectroscopy, which is a way of looking at basically molecular species in the brain and looking to see if those molecules are changing at all in one group or another group. The molecule that we were most interested in this study happened to be glutamate, which is this peak right here. And what we found was that specifically in cancer survivors with fatigue, we found higher levels of glutamate, specifically in the posterior insula, and then we also found elevated levels of cytokines in the blood, elevated levels of IL-6, which is an inflammatory cytokine. So we're having evidence of both inflammation as well as excitotoxicity potentially in the insula. However, what was surprising was these two effects were not related. It looked like the individuals that had elevations in glutamate were not the same individuals that had elevated levels of IL-6 or the inflammatory cytokine. So that gave us a little bit of information, but it didn't give us a whole lot. So we then turned to look at functional connectivity, which is a way of looking at how different areas of the brain are connected using a non-invasive technique, using the MRI magnet. And so I'm going to jump ahead to the study where we looked at stimulating and relaxing acupressure to see if we could look in the brain and see if relaxing and stimulating acupressure actually had differing effects on brain connectivity patterns. And this is the final slide where we found that there was actually really a remarkable difference in how relaxing and stimulating acupressure affected connectivity to the default mode network, which is a constellation of regions involved in self-referential thinking. And so this is the default mode network here, these regions and this one combine the default mode network. And what we found was that relaxing acupressure yielded greater connectivity between the superior colliculus and the default mode network, whereas stimulating acupressure yielded greater connectivity between the pulvinar, bilateral pulvinar, and the default mode network. And you can see this down here on this scatter plot. I don't know if you can see it over there, but it was really remarkable. What we're plotting here, these black circles are individuals that are showing relaxing acupressure. Every one of these individuals had an increase in connectivity between the default mode network and the superior colliculus, but they showed decreases in connectivity to the pulvinar, whereas the stimulated group had increases in connectivity to the pulvinar and decreases in connectivity to the superior colliculus. So what does this mean? How does this work in terms of what's going on in the brain? What does the superior colliculus do, and what is the pulvinar doing here? So we looked back in the animal literature, and interestingly enough, we found that the superior colliculus, when you give a lesion to the superior colliculus, you obliterate REM sleep. There's poor sleep in rats that have their superior colliculus removed. So that's interesting. It seems like relaxing acupressure is promoting superior colliculus activity, whereas if you ablate the superior colliculus, you have impairment in sleep. What about the pulvinar? Interestingly, if you do a similar manipulation and deactivate the pulvinar, you get an increase in low frequency power, and that increase is remarkably similar to what's happening in animals that have low slow wave brain activity. It's mimicking sleep almost. So when you deactivate the pulvinar, it looks like the brain is becoming less responsive and almost sleep-like. So in essence, this is what the paradigm looks like. It looks like relaxing acupressure promotes sleep by connecting the superior colliculus to the default mode, whereas stimulating acupressure does the opposite and promotes wakefulness and pulvinar activity. So the two treatments we thought might have differing effects on alertness, and indeed it looked like they did. So I'll finally finish with this slide, which shows that we actually have an acupressure app which we've developed and is available on iPhone and Androids. And this app is able to teach you how to do acupressure by yourself if you want to. You can download the app and you can track your symptoms over time, and it shows you where to apply the acupressure. And we're now using this app in future studies where we're mailing tablets to patients, and they can download the app and see how to do the acupressure, and they can just track their symptoms. So in conclusion, it looks like symptom clusters occur across multiple clinical conditions. For cancer survivors, fatigue and pain are considered to be the most bothersome. Fatigue and pain are associated with altered brain neurochemistry and connectivity. Self-acupressure reduces all the symptoms in the cluster, but not in the same individuals. Acupressure may modulate this brain connectivity, and does the state of the brain at the time of treatment influence responsiveness? I've been very fortunate to work at the University of Michigan, And I'd like to highlight my colleague, Dr. Susie Zick. She's very instrumental in these studies. She's a naturopathic physician, and she and I have worked many years in this field, and I've been very fortunate to also have funding from the NIH and the Department of Defense. And I'd like to thank you all for listening to me talk.